Recently, Prevent went back to Guatemala's western highland region around the Lake Atitlan and the remote towns in southern Guatemala, where the native Maya make up the greatest portion of the population. These regions have one of the highest rates of infant and maternal mortalities in the Western Hemisphere. To improve reproductive health and well-being, we visited Hospitalito Atitlan to convene a meeting of several local midwives with the hospital's administration to improve the teaching of traditional birth attendants in adherence to the local culture and custom of Maya. Our staff also engaged in a teaching program of neonatal resuscitation, which makes a great impact on infant survival. At the hospital, we learned about the need for preventing child marriages and pregnancies. In cooperation with Guatemala Village Health, we visited and contributed funding to the completion of the Monterrico Clinic. This region of Guatemala is surrounded by polluted marshes where human and animal waste is discharged in the waters where the local population fish and sustain themselves. There is a high incidence of child diarrheal diseases in this region, which can be reduced through building sanitary latrines and inexpensive biologic water purification methods. At the Population Council in Antigua, we offered our assistance to the programs that promote gender equality, especially as it relates to access to healthcare services. At Achoqui in San Juan Camalopa, we made a pledge to help the local program of midwifery training. At Manos Abiertas in Ciudad Vieja, Prevent made a presentation on the diagnosis and management of postpartum hemorrhage, one of the leading causes of maternal death in Guatemala. Prevent has a program to distribute its kits containing priority essential medicines for mothers and children in Guatemala at secondary health clinics in rural areas.
That's why we want to put these medications in a kit and make it available to as many groups as possible.
The WHO highly recommends access to these vital and inexpensive generic medications for saving lives at birth. Helping people help themselves at the community level in collaboration with organizations such as WINGS, FAPE, and Oxubats, Prevent is putting together programs in family planning, adolescent reproductive health, and educating male partners to make a life-changing impact of the vulnerable population of women and children in Guatemala. Through your support and generous financial contributions, we can make a measurable impact in maternal child health.